What is mumps? Mumps is a contagious illness caused by the mumps virus, part of the paramyxovirus family. It starts with mild symptoms like headache, fever, and feeling tired. Then, it usually causes painful swelling in the salivary glands, making the cheeks puffy and the jaw sore. Mumps was very common in children before the mumps vaccine was introduced in 1967. Since then, the number of cases has dropped a lot. However, mumps outbreaks can still happen, especially in places where people are in close contact for a long time, like college campuses. You can protect your child from mumps by getting them the measles, mumps, rubella MMR vaccine. While mumps is usually mild, it can sometimes lead to serious problems. Who does mumps affect? Mumps mostly affects children between 2 and 12 years old who haven't been vaccinated. However, teenagers and adults can also get mumps even if they were vaccinated, because the vaccine's protection can weaken over time. Despite this, the best way to prevent mumps is to get fully vaccinated. What are the symptoms of mumps? The first symptoms of mumps are often mild, and many people don't have any symptoms at all, so they might not know they're infected. Symptoms usually take 7 to 25 days to appear after being infected. Mild symptoms of mumps can include fever, headache, muscle aches, fatigue, and loss of appetite. A few days later, you might get painful swelling in your parotid glands, which are salivary glands between your ears and jaw. These swelling, called parotids, makes your cheeks puff up and your jaw swell, giving you chipmunk cheeks. This happens in over 70% of mumps cases. It's important to know that many different viruses and bacteria can cause parotids, so it doesn't always mean you have mumps. Rarely, mumps can affect other organs like the brain, pancreas, testicles, or ovaries, especially in teenagers and adults. If your child has any of these severe symptoms, call their healthcare provider right away. High fever, stiff neck, severe headache, confusion, stomach pain, vomiting, or seizures. What are the causes of mumps? Mumps is caused by the mumps virus, a type of paramyxovirus. It spreads from person to person through direct contact with infected saliva or respiratory droplets from an infected person's nose, mouth, or throat. You can catch mumps if an infected person sneezes, coughs, or talks near you, or if you share items like toys, cups, or utensils with them. Activities involving close contact, like playing sports, dancing, or kissing, can also spread the virus. Some people are more likely to get mumps, including those with weakened immune systems, people who travel internationally, those who aren't vaccinated, and people living in close quarters, such as on college campuses. Is mumps contagious? Yes, mumps is a very contagious viral infection. If your child has mumps, they can spread it from a few days before their glands swell to up to 5 days after the swelling starts. To avoid spreading mumps, your child should stay away from others and not go to school or childcare. Even if someone doesn't have symptoms, they can still be contagious. Up to 1/3 of people with mumps don't show any symptoms but can still pass the virus to others. How is mumps diagnosed? Your child's healthcare provider will ask about their symptoms and do a physical exam. They might be able to diagnose mumps by looking at the swollen salivary glands. The provider may also ask for specific tests to confirm the diagnosis. How is mumps treated? There's no specific treatment for mumps. It has to run its course and usually goes away on its own within a couple of weeks. Treatment focuses on making your child comfortable by managing their symptoms. Here are some steps to help. To help manage mumps symptoms, make sure your child drinks plenty of fluids and gargles with warm salt water. They should eat soft, easy-to-chew foods and avoid acidic foods that increase saliva. Sucking on an ice pop can soothe a sore throat, and placing ice or heat packs on swollen glands can reduce discomfort. You can also give them non-aspirin medications like acetaminophen or ibuprofen to reduce fever and pain. Don't give your child aspirin. Children with mumps who take aspirin can develop Reye's syndrome, a serious condition that can cause liver failure, brain swelling, and even death. Can mumps be prevented? Mumps is easy to prevent because the mumps vaccine is very effective. Doctors usually give this vaccine as part of a combination vaccine that also protects against measles and rubella, called the MMR vaccine. Children usually get 2 doses of the MMR vaccine as part of their regular vaccinations. The first dose is given between 12 and 15 months old, and the second dose is given between 4 and 6 years old. Mumps is now rare in the United States, with only a few hundred cases each year. However, outbreaks still happen, especially in places with close contact like schools and dorms. This is why it's important to vaccinate your child to lower their risk of getting mumps. Even on college campuses with high vaccination rates, mumps outbreaks can occur because the vaccine's protection can weaken over time. In these cases, public health officials might recommend a 3rd dose of the vaccine for those involved in the outbreak. What complications can mumps cause? While mumps is usually a mild disease, it can cause serious complications. These complications may include arthritis, inflammation of the joints, deafness, permanent hearing loss, encephalitis, inflammation of the brain, meningitis inflammation of the tissue covering the brain and spinal cord, oophoreitis inflammation of the ovaries, orchitis inflammation of the testicles, pancreatitis inflammation of the pancreas, and thyroiditis inflammation of the thyroid gland. Mumps during pregnancy is usually harmless, but in rare cases it may lead to miscarriage, premature birth, low birth weight, birth defects, or fetal death. If you are pregnant and have been exposed to mumps, see your healthcare provider right away.